Great. So POTS is a one-stop shop located in the Bronx. We serve 30,000 people each year, and our goal is to meet the basic needs of the low-income individuals and families in our community. We do this through a multi-part approach. We were founded in 1982 as a soup kitchen, and that is part of our services still today. And over time, through listening to people about what their needs were and being aware of what we could provide, we've expanded our services. So we now offer a food pantry, supermarket style food pantry. We have showers, mail, haircut, and clothing program for people who are live on the street mostly, some people who are housed and don't have safe mailing addresses. We have case management and legal services. The case management helps people access public benefits, helps people get advice and referrals to different types of agencies that might help them, provides access to tax services, financial counseling, health insurance, a whole range of services like that. And then we also have lawyers who will help prevent evictions. Um, we prevented 450 evictions last year. We also have two on-site people who will help with immigration. So should somebody have a pathway towards immigration but not be sure how to get there, we have advocates who can help work with them. And we have a case manager who works on employment services and a case manager who works on long-term goal setting. And that's the project that we were seeking to evaluate. So this case manager works with people who have complex long-term goals, finding a job, getting out of a shelter, uh, perhaps getting a degree, increasing their skills, helping out their children in certain ways, and we help break down those goals into smaller steps and provide the resources that they need in some cases to help meet those goals, and in some cases we provide advice and counseling.
Hi, my name is Harshini Leshi. I am a principal consultant and founding partner of 8Res LLC. We are a boutique consulting firm based out of New York City. We work with organizations to help them with their research, evaluation, and strategy. And last year we had the opportunity to work with POTS on a multi-phase project. And what was really interesting about this project was, as evaluators, we really have the opportunity to connect different phases of a project and to see how those phases help inform practice in a tangible way. However, with this evaluation, most evaluations, end with the recommendations for improvement. However, when conducting this evaluation, we had the opportunity to take a 360 view. And so we got to see the recommendations put into practice, and we also had the opportunity to actively support the organization.
So when we decided to do a multi-stage project, we were looking at developing a program like we'd never developed before. In the past, all of FOSS services had been focused on giving out resources to people who needed them. So it'd been somebody needed food, we'd provide them with food. If somebody needed a shower, we'd provide them with a shower. If they needed an eviction prevention, we'd provide them with eviction prevention. But this service was different because we're asking people how they're looking to change their own lives in a way, and then just providing the support to do so. So we didn't think that would we didn't want to A, reinvent the wheel, and B, we wanted to make sure that we were, what we had started was to see whether or not it was effective. And then C, we needed to figure out the best pathway forward based on the information that we'd learned from the first two. So the state of the field that we worked on was designed to help us understand what others were doing in similar type of work to make sure that we could do a good job. The second stage of the evaluation of the program was to help us understand, based on what we were doing so far, what was working and what wasn't. And then the third part was to help us incorporate stages 1 and 2 into a plan for how to properly evaluate and make sure that we're taking all of the information we got from outside sources, taking the information we got from the evaluation, and making it into a plan for our next steps for the program.
So working on the state of the field gave different perspectives across different levels of operation. So what is often missing from an evaluation is a systematic assessment of the field to help inform best practices. And with the state of the field, we were really able to not only hear from clients, but to merge that with the academic literature and to hear from other practitioners in the field. So really bridging that gap between research and practice. So here we looked at the client level, where we spoke to clients of the CCM program, the Comprehensive Case Management Program that that we were evaluating for POTS, to hear what worked and what didn't work, and areas that could be improved, how the program helped facilitate change in their lives. Then we also spoke to practitioners in the field who have been doing this in somewhat similar and some similar in some different disciplines, to hear how what they consider to be best practices, what they um, use to change to facilitate change, sorry, in their organizations, and then we merge that with theory from the academic literature. Something that was interesting is being able to look to other disciplines and explore the field beyond just comprehensive case management, and recognize that client engagement and getting clients to make change towards some sort of actionable outcome is seen across disciplines. And so we were really able to borrow from other sectors. And I think that's something that's not often really done. We often work in silos, so it gave an opportunity to really borrow from other disciplines.
So we embarked on the state of the field to learn more about how the best way to provide these types of services to clients. And it was really valuable to learn from other agencies. Um, Agencies that have, even different types of focuses than we do, sometimes are doing the same type of work that we're looking to do. And they it did two things. In some cases, it validated what we were already doing. There were some things in there that we had figured out and were doing and had implemented. But more importantly, it helped us see how we could improve what we were doing in certain areas. So an example being the focus on the cohort-based approach. So we're now thinking about how can we create, if we can create cohorts. If we can't create cohorts, then how do we create sort of sessions where people can come together and interact with each other and do a peer-based um, uh, analysis. So that was something we saw in the state of the field, that there are other groups that used peers and cohorts to help self-reinforce the work that they were doing with the clients. And so, and there are a couple other things like that. And it really, the other thing was its breadth. So the state of the field was focused on not just how does the individual sitting at the desk work, but how do you hire that individual? How do you work with other agencies to make sure that individual has the support that they need in the services they're providing? How do you, how can they assess the client, and then how can the client, then take that feedback and go forward? So there's a whole range of ways in which POTS could structure its programs in order to make sure it was doing the best it could. We've definitely made a bigger effort at using some of the tools on figuring out readiness for clients and helping them work through their stages of readiness. I think that has a technical name that I'm drawing a blank on right now. So that's one thing that we have done. Another thing that we've done is sort of think about how we might want to hire as we bring on new people. And we could potentially have the opportunity next year to expand our program by another staff member. And so as we do that implementation, we're using some of the ideas that were brought to us in the approach. And the other thing agency-wide that we're doing is there was a good discussion about how to manage case manager burnout, and sort of trying to incorporate those types of things into our staff meetings, and making sure that generally overall we're taking care of our staff who are taking care of our community.
So for the evaluation component, we did a mixed methods process and outcome evaluation, where we took cross-sectional data and did a quantitative analysis over a 3-year period, and then incorporated client feedback through interviews that helped inform and make sense of the key features of the quantitative analysis.
When we embarked on the evaluation process, we were trying to see whether or not, our program was effective. And the first step was to understand, how do we know if our program's effective? And working with the evaluation team was really helpful, because the only thing we had been talking about was the stability index question. And in some cases, we have an internal stability index that measures how people move in terms of their in and out of poverty in a range of areas, and our focus had been on that. And in some cases, it actually is not iterative enough to show any movement, even if movement has existed. So this survey uncovered that. Um, but it the other thing was that we looked at it from a different angle, which was how many goals have been completed and how many needs are being met by people in our population. So if somebody is working with the case manager, are they meeting their goals? What percentage of goals are being met, and what are the different types of demographics? Who's meeting those goals? So there are a number of different ways of looking at it that we discovered through the evaluation process that we, as an agency that doesn't have experience with evaluation, wouldn't have uncovered on our own. And so it helped us understand what populations we were best at serving, which in this case was surprising to us, as it being homeless men in most cases. And then it helped us uncover ways in which we could improve our stability index, which wasn't necessarily what we were going into it looking for, but it was clear that there were things that we needed to do, because it would help us see if we were making improvements better if we changed the way we had it set up.
Something that was really interesting in terms of the findings was that we actually found statistically significant findings. And I think in this type of work where, it's very complex, often the outcomes, their long-term outcomes, you don't often expect to see anything significant. But we did, despite small effect sizes. And for POTS, I mean, they weren't expecting to see anything significant. And so this really helped validate the work that they're doing, because, it's hard work and you don't think you're making a meaningful difference. But when the data come back and show that, that can be really validating and reinforcing of the good work that they do.
It is not as useful a tool for funders as I was anticipating. Many of them, it's kind of in the weeds for them, I think. Did they want sort of a big picture, that in a way that the evaluation is not meant as a criticism, but it doesn't give the kind of like nugget of this is what you're doing that they're really looking for from a messaging perspective. But it did a couple things for us. One, it helped us understand how to improve in many ways, how we should be improving our program going forward internally. So POTS's goal is we need to get money in order to do so, but generally our goal is to help people. So it helps us with that process of helping people. And the other thing that was really surprising to me is that it was extremely motivating for the case managers involved. So there's a lot of grind in and out. You see clients, sometimes clients are doing well, sometimes clients aren't doing well, and it's hard to see the big picture. But in fact, having the evaluation around and being able to share that evaluation with our case manager, it was really amazing for him to say, "Oh my goodness, this is what I've done," and feel it drove him to feel more motivated. He's in the process of pursuing a master's degree in psychology, and it has helped clarify his vision for what he wants to do in his life and with his career. And having that kind of motivation available for your staff members, being able to show, hey, look, this is a big picture of what you did, it helps them do their job better. And it also helps him see where he could improve, and he was fine with that. He didn't see it as a negative thing, that there was some areas to improve. It was overall, it was really a positive thing for staff. And then from a managing perspective, of course, we can improve and change our programs as time goes on to make sure that we're meeting our client needs as best as possible. It also showed us that basically one of the big things was we don't have a very defined approach towards plugging people into the program. And so I think, one of our big tasks is to start setting more definitions. What are different types of roles? Maybe what different types of areas of someone's life do they fit into? How do we define the time frame? When do we set goals certain ways? So there isn't a lot of standardization, and there will be a point where dealing with people's lives, so it's hard to standardize, but having a bit more standardization would allow us to do more evaluation. And so that's helping us in our process of standardization.
It was really easy to work with POTS because they're an organization that's rooted in learning. And as evaluators, you often um, are dealing with organizations' evaluation anxiety. Um, and, POTS is an organization that wasn't afraid to ask questions. And our philosophy as an organization ourselves is, we may know evaluation, but we don't understand the context or the content. And so there was a lot of partnership where we learned from POTS and they learned from us, and so it became this iterative process that was very participatory in nature, which we think helped with the utilization of the data, um, making it more relevant to them. So many of the meetings we discussed uh, questions that were relevant to ask. For example, when designing the interview protocol, which methods they thought would be the most appropriate for the target audience that we were speaking to, and then even reviewing the data and findings was an opportunity to hear more about what POTS thought was most relevant and most interesting about the findings, so we could lift those up.
Yeah, no, working with the evaluators was very easy. We fortunately had some evaluators who knew well about our programs and the types of work that we do. They weren't coming from a different industry. And also were knowledgeable about other nonprofits in New York City. And so it wasn't too theoretical in the sense that like they could come to us and talk to us about our programs in a way that we understood and they understood. And so it was really easy to be able to provide the information because we knew exactly what they were looking for, and they could clarify things for us in a way that allowed us to figure out how can we answer this question that they might have, or if we can answer that question. And so because it was someone who was able to break it down for us into pieces that we could handle, it was an easy process. And also they're available for feedback in both directions, answered questions. And when we had clarifying notes, I remember originally with the state of the field, for example, there was a different understanding about what type of thing we were looking for. And it was, just making sure that we had a quick conversation and there was a structured process throughout where we had meetings about very specific things. And so it was easy to catch those areas when that happened before any sort of problem unfolded.
So in bringing the state of the field and the evaluation together, we really provided POTS with ongoing support. And, the state of the field provided a lot of recommendations. There were a lot of changes that could have been made based on best practices. And the evaluation provided very specific changes. And so talking to POTS and really recognizing, what was feasible given the time and resources that they had, and then helping them to really put things into practice. So seeing sort of the beginning, middle, and end of the whole entire project was something that was really profound.
One of the things was that after the state of the field and the evaluation, the evaluator didn't just go off into the sunset. They were both able to help us with some additional things that provided us with the groundwork in order to move forward with our program adjustments as we go forward. One of those was through helping us with our Salesforce database. We have a customized Salesforce database, and there were some areas in which we saw that it needed update, and our evaluator interfaced with a Salesforce person to help us make those changes. That's super helpful because often people who are good at Salesforce don't really understand programs very well, nonprofit programs, and so having somebody there to translate was really extremely helpful. And then the other thing that we did was with the evaluator helped us by updating our logic model. So that'll help us with our measurement going forward. So we didn't have a solid logic model for the program, and now we do, and that will help us a lot with both with funding requests, but also with how we can think about developing our program in order to meet our goals. And then finally, the big thing was around our stability index that I mentioned earlier. Our stability index measures whether or not people are stable or unstable in 5 areas: health, housing, education, day-to-day needs, and forgetting one. Oh, financial, in their financials. Um, And and we found that the education and health ones were not working very well for different reasons. The education one didn't show how people moved. So we helped a lot of people with education things. But you couldn't see it because the only thing that the stability index measured was whether or not they had a GED or a high school diploma. And some clients had GEDs and high school diplomas, and we helped them with workforce development training or other things. Some people didn't, and we helped them get there, but we didn't necessarily they didn't cross over in the period. So what he has helped us do was create a multi-stage process for education that helps us see those movements as they happen. So that will help us see what work we're doing better. The other thing was around health. So our health goal was measuring whether or not people had access to health insurance, which is valuable, but it wasn't necessarily accurately measuring people's health. So the vast majority of our client population does have health insurance because Medicaid is quite widespread in this community. But most people are fairly unhealthy, and either they or somebody else in their household is unhealthy enough that it's holding them back from working or range of other different things. So we've changed that health measure, and that will help us understand people's health. And the question now is your health or the health of someone in your household getting in the way of your success? And people can rate themselves on that. One of the things that we're still figuring out is how do our subsequent work with clients move people in the index? To help someone get access to counseling, does that mean we've helped them improve their health or not? And that's something that we're still working through. Organizations would benefit from it. I think because of the way nonprofits are structured, they tend to not necessarily always be able to benefit from all of the trends in the field, so that having access to the state of the field is a good thing. But also having the opportunity to evaluate all of evaluate your programs to see how you're doing, that's also a good thing. But without that last step, putting it all together, figuring out the next piece, a lot of the time we don't have staff members who are just who have knowledge and background in that area to be effective. So without that last piece, you have two reports that are nice and informative, but don't necessarily provide you with the ability to move forward in building your programs and making them more improved. Just because of the nature of how nonprofits hire. You don't have the resources for an on-site evaluator or somebody who can do this sort of work. So having that third piece and having multi-stage evaluation is, I think, really effective way to use an outside consultant to make your programs better in the long run. I've been a consultant, not in evaluation, but on both on strategic planning and development. And there were times when we had projects where the goal was to produce a report, and you sort of knew that that report was not necessarily going to lead to much once the report was handed over. And so by having this extra stage, that means that there's it helps you come up with concrete ways to put that report to use. And that's really, that's what you need. We were very fortunate to receive some funding for this type of work. And I think it would be important for people who are funding nonprofit organizations to realize that it's important to fund this sort of thing. There are often times when it can be considered unnecessary or overhead or whatnot, but the way that nonprofits can grow and change without the support of funders, we can't do these types of multi-stage evaluation processes. And so I think it's important to keep in mind that providing just for basic program delivery is not the only way that funding can improve a nonprofit organization. And then the other thing that I would say is that it was really nice to have time set aside to take a step back, especially for program staff, to take a step back from their programs and say, what are we doing? Especially in an agency like ours, where we have nearly 800 people coming through our doors every single day saying, I need help right now. It can be hard to take that bird's eye view, because you're really focused on, oh my gosh, there's somebody waiting for me in the waiting room and they are hungry and they are whatever, they have need. And I'm here to, I have to get through them. I have to get to them. I have to talk to them. I have to help them. But this allowed for a time for several of our program staff to come together and think critically about the program that they're serving in order to improve that program and not just be stuck in the day-to-day grind, which is also valuable, but you just sometimes it's good to get a step back to make sure that you're thinking about the structures of your programs and that you're serving clients the best that you can.
Something that was really unique about the project was actually hearing from all the so with the respect to the state of the field is hearing all the different voices. You don't often have that opportunity to hear. I mean, you work with a client and perhaps you work with their stakeholders, but hearing from other practitioners in the field and reviewing the literature in depth. And so that 360 understanding just in the state of the field itself was really unique to this project. And I think it expands beyond something like a needs assessment, because it allows you to recognize that you can learn from different disciplines, and borrow from best practices in different fields. For example, sports based youth development, or behavioral science, and there's something to learn across disciplines.